Welcome back to Open Your Eyes. It is a Friday, a fun Friday at that, and we've got a fun crew will be joining in just a few. Actually, the conversation will surround World Diabetes Day, which will be celebrated tomorrow across the world, November 14th. And we've got the crew in to tell us all about it. Dr. Amin Igar is in with us. He's an ophthalmologist at the Belize Vision Center. Dr. Aline Gonzalez as well, who is the vice president of the Belize Lions Club. Lynette Valerio, who's the acting president of the Belize Lion Club, and Ronald Stewart is in with us as well. Good morning and welcome to you guys.
Good morning.
Good morning.
Morning.
Good morning, John. It's the Belize Diabetes Association.
Oh, well, you know what? Thanks for the correction.
Yeah. All right.
So guys, we know what how tough it is when we hear the word diabetes. We know, for the most part, there is somebody who knows a few people who are suffering from it, and especially the way we eat in our country, our livelihood, our cultures. It is a tough one. So let's jump on into it. Let's go with, let me see here, Lynette, Miss Lynn. Good morning once again, as you represent, your club. Let's talk about diabetes and what we're seeing in our country, the trend that we're seeing in our country, before we get to the celebration of tomorrow.
Okay, John. Thank you so much. So diabetes, John, is a condition that we could never stop being talking about. In the world, 463 million people are living from diabetes. The International Diabetes Federation Diabetes Atlas of the World states that 1 in 11 person has diabetes. It states that 1 in 2 adults has diabetes and don't know it. And every 8 seconds, somebody dies from diabetes or from diabetes complication.
Wow.
For our country, that's a lot of people living with diabetes. But what is diabetes really, right? So diabetes is a condition that occurs when the body cannot produce enough insulin, or the insulin that the body uses it cannot use the insulin that it produces. When we eat food, for example, such as starchy foods or carbohydrates, foods such as bread, tortillas, rice, pastas, and all kinds of starchy foods, these foods get broken down into sugar. And to get the sugar out of our body, we need insulin. And insulin is that hormone that is produced by the pancreas to transport the glucose from the bloodstream into the body cells, where it is used as energy. Now, just imagine now having a lot of carbohydrates into your blood. A lot of carbohydrates, you eat that in the form of rice and beans and all these heavy carbohydrates. So the more of these food that we eat, the harder the pancreas has to work to produce insulin. And so you could imagine now the lack of insulin in the body, creates the condition diabetes. So diabetes is really a lot of glucose or sugar in the bloodstream. And that's why the sweet blood. So that's in a nutshell what diabetes is all about.
You definitely blew apart one of the most important misconceptions that people have, where they say, well, I need a lot of sugar, so I can't get diabetes. But how much rice are you consuming? How much bread are you consuming? How much do you exercise? And is it in your family history? Which are all some of the issues that we know can contribute towards diabetes type 2. Lynette, do we know how many diabetics we have in our country?
Yes. So in Belize, the International Diabetes Federation Atlas, which we at the Belize Diabetes Association is a member of, it is estimated, and in the last edition released November 2019, that 14.9% of our adult population between the ages of 20 and 79 is living with diabetes. In Belize, we also have approximately 90 children who are type 1 diabetes. So type 1 diabetes is usually found in children because they're insulin resistant. Their body is unable to produce the insulin. But the most common type of diabetes is type 2 diabetes. And although we don't know the reasons for developing type 2 diabetes, we do know that there are several risk factors, such as obesity, poor diet, physical inactivity, family history of diabetes, and high blood glucose during pregnancy. In a nutshell, 14.9% almost 20% of our adult population in Belize is living with diabetes.
Wow.
But
is the second leading cause of death in Belize, Marlene.
That's right.
culturally,
That's right.
it's a scary thought, and I'll tell you why. Because look, growing up, especially if you're your rural communities, we put hands in flour every day. It's either tortilla, it's fried jacks. So that brings forth, of course, some oil with it. Then weekdays it's rice. Weekends, probably Saturday it's a soup. Then on Sunday we go right back to rice and beans. Rice, stew, beans on Monday. And so we're eating these things on a daily basis.
Yeah.
We're not watching what the amount we consume, and we might not be doing anything. So can somebody tell me, while we continue to eat these things and find them as a regular staple in our country, what can we do to try and not get diabetes?
Right.
Well, it's certainly one of those situations where we have to equip ourselves with information.
Yes.
A lot of times we do not think about what we eat or plan for what we should.
Ronald, we seem to have lost your audio there for some reason. I'm not sure why. Can you hear us?
Yes.
He went on mute.
Okay, I think he muted himself by accident. So one of the ways, and we had a great poster up talking about some of the signs for diabetes. Unfortunately, some people don't know they have diabetes until they start to develop problems. And this is a great way to get the Lions Club involved and talk about the program that you have in screening. Let's talk about that.
Okay.
Okay, morning everyone.
Morning.
Thanks for letting. So we are the Belize Lions Club. One of our mandate that we have is diabetes type 2, no? Not really the type 1 diabetes, but more type 2.
Yeah.
And as Lynette well mentioned, there are some symptoms and signs to show that you have this, right? We always go with 3 Ps. We have polydipsia, polyphyha, and polyuria. And so one of the main things that you notice when you start having diabetes is that you start having urine problems. You start having more urine than normal, start eating more than normal, and of course, you start getting more thirsty than normal. These are some of the signs that you have diabetes, one of the main signs. Back in the days before diabetes was really diagnosed properly, what they used to do was, if I'm talking about back in the 19s, in the 1700s and 1800s, were to pee outside, and ants used to come and in the urine. That was one of the signs of diabetes. And it was actually called the pissing evil. So that was one of the signs of diabetes, and we know that people develop it because, again, because of the diet.
Yeah.
Almost everything that we eat breaks down to sugar. So carbohydrates breaks down to sugar, and that's what actually causes the diabetes to develop in us. But on another note, the Belize City Lions Club, we try to work with our different partners, Diabetes Association being one of them, and also on next week, the 21st, I think, of November, we're doing what we call diabetic healthy drink. We notice that we in our community, we have a lot of bad habits. As you guys were mentioning, we tend to be attracted to the sugary stuff,
Yes.
right? When I take my kids out, for example, to get a drink, they want the milkshakes, They want the smoothies with all the chocolate in it and all the ice cream in it and all this stuff in it. My kids would never ask for a healthy drink. And so we're at the Belize Diabetes Club, what we're to do is to bring awareness, and we're doing a healthy drink challenge for next week. This is for the members. We're doing this in collaboration with Public Supermarket. We like to partner with different people. One of our partners, of course, is Belize Diabetes Association, and we're partnering with the Public Supermarket. And the challenge is you make a drink, you video yourself making a drink, we submit it to them, they will choose the winner, and then they will invite the winner to come and make a drink in the store. And so, it's supposed to be a healthy diabetic drink,
So what is a healthy diabetic drink? Because I'm not sure where I would even start.
Okay, very good.
Because milk has sugar, right? I mean,
we
if
want
you
to just
put,
cut down on the sugars.
yeah,
We want to include more greens than sugars.
okay,
Stay away from the starchy stuff. Even though fruits have certain sugars, we want to use less fruits, more water, and more greens in the diabetic drink, you know? As compared to drinking a Coca-Cola or drinking some other kind of soft drink, you know?
Yeah.
so putting
Yes.
something like an apple in there that will add natural sweetness but not too much sugar is a good way to start.
It's a very, very good way to start, yes, of course.
Wow.
Okay, that's cool. Because I think you're also, I mean, while you're challenging people to be creative, everybody else who watches will learn new drinks that they can make at home
Right.
that are healthy.
Right.
Yeah.
Instead of using the regular milk, we can use the skim milk.
Yes.
Yeah.
Percent milk as well. You know, a lot of us sometimes we go to the store and we instead of picking up the diet milk, we pick up the
Full
regular.
cream, yeah.
That's more. It has much more sugar than the skim milk. You know.
All right, Dr. Gonzalez, let me put you on the spot here, all right? You got to share one of your secret recipes for your healthy drink so we have an idea of how it works.
Yeah.
What's a healthy
One of
shake
yours.
you make at home?
Well, my wife is the one who normally makes the shakes. She's more diabetic friendly, I would say. She will get and she also use a lot of green leaves, sometimes even spinach.
Okay.
More water and flax seeds. So she tend to combine some of these stuff, and she will put a little bit of maybe like a little bit of banana in it, or maybe something like you said, the apples.
Yeah.
And she has some really really good recipes. So I didn't bring one of the direct recipes. Yeah, it's basically combining more starchy food, sorry, more
Greens.
more leafy vegetables in the shake than combining sugar with stuff, you know.
Yeah.
Yeah.
And Dr. Eminegar, we see you, buddy. We see you. We know that when it comes to diabetes, it does affect your vision as well. So jump on in. Tell us your part in this.
Yeah, I would say this is the most important part because a lot of people are affected with diabetes, what we call diabetic retinopathy. As you know, the retina, that back part of the eye, area of the eye is we call it the outer brain, where the light filters through the lens, to the crystalline lens. Images go to the optic nerve, to the brain. Okay. What is affected in diabetic retinopathy mainly is that we have fine little arteries throughout the whole body. And you see, the eyes are very more sensitive. These little arteries start to create little pouches of arteries, and then eventually they can bleed. But I want to stress that the most important thing in preventing diabetic retinopathy, retinopathy disease of the retina, right? The most important thing is prevention. How we should prevent diabetic retinopathy? By checkups. You know? The National Health Insurance has instituted a program in which they help, especially the poor people. In the past, it was Southside people, and they send them yearly for a yearly checkup, not only for diabetes, but for any other disease, no, which affects the eye and the retina. So these small little arteries can eventually bleed and create what we call diabetic retinopathy. Then it bleeds into the vitreous, and then the patients stop to see completely. But prevention is better because if we examine the eye early and we see these little pouches of little arteries beginning to probably want to break and create the disaster, we can laser them. And now we have a medication that we inject into the eye, into the vitreous, the eye, called Avastin, and we save a lot of. I'm using it in the clinic, and believe me, patients come practically just counting fingers. After a month, they start to see again when they're relieved. It didn't happen in the past. No? We didn't have it in the past, that medication, but it helps a lot. But again, prevention is better than cure. Besides this problem in the retina, diabetes can also cause glaucoma. As a result, it can cause cataract. And those things, cataract is not much of a problem. We operate the patient and patients can see back again. So we can, if detected early, we can treat it. everything is better when you prevent it.
Yeah.
You know, prevention is better. So
Dr.
when patients come to
Agar,
my
Dr.
Yes.
Agar, how often is it that you find out, you diagnose diabetic retinopathy, that diabetes has affected the eye and the person doesn't know they have diabetes?
Okay, yeah, that's very true because patients may not know. Of course, I usually in the history, I ask them if they suffer diabetes, if they suffer hypertension. What are the two main things that Belizeans suffer?
Yeah.
I ask them and say, they don't know when they're over 40. How is your family history? Well, my mom or my dad or both of them have diabetes. So I always do them a quick random sugar test. And that over 150 to 100, you are diabetic. You can't get glasses right now because most probably you are diabetic. Go to the lab and get one fasting blood sugar, you know?
Yeah.
And also when we dilate how we detect diabetes, it's also by putting eye drops, which burns a little, it's
Yeah.
painless. And then we check into the eye and we see beginning of diabetic retinopathy. Little arteries deteriorating, trying to break. We suspect he might have diabetic retinopathy, so we send them immediately to do a blood test for diabetes.
Yeah.
You know? So,
And that's a key point, because I think sometimes people don't realize they have diabetes till they start to face some of the complications. Because it is a silent disease. It's taking place in a condition that can take place inside. Let me hear from Lynette for a second, or Ronald, just to talk about what you offer to diabetic patients at the association.
Marlene, so what we could, go ahead, Ronell.
We offer education in the first instance, and we also have opportunities for them to purchase some of their supplies.
Okay.
We have strips, we have monitors and lancets, alcohol pads, and so on. There's much more that we could do, but as time goes by and resources being available, we do that. The thing about it is keenly though, not only for persons who are living with diabetes, but the population on a whole, because there are several of us members of the association, like Val and myself, who are not living with diabetes, but simply wanting to keep ourselves healthy. So we have to have access, or we access the information as well, so that it informs us as the things that we need to do to avoid being developing the condition. And therefore it saves us immensely over time, and also contributes to maintenance of a quality of life that is always better.
Yeah. Yeah, you know, and I went culturally with my previous question, and I'd like to know though, in terms of people who are getting it, are we seeing a rise in the numbers?
Type
Yes.
2, certainly.
Yeah.
Yes, certainly in type 2, yes. We have seen a rise in the numbers, and it is estimated that by 2030, 10 years from now, we'll see a considerable increase in the current population, people who are living with diabetes. And I think what is more critical though is that, you know, the awareness continues to take place. And that is something that we also do at the Diabetes Association. Before COVID-19, you know, we would always go out in the community to do free tests, invite persons to come to our office to do free testing. You know, we would do free testing to screen people who are, you know, who could be at risk for diabetes, or people who have family history of diabetes. But because of COVID-19 now, we find that we are unable to do these public free testings. So what we want to focus on, and this is something that the Belize Diabetes Association is working on, is to get people to come and do their A1C. So what is A1C? A1C is stands for hemoglobin A1C, which is really a marker taken from the blood. It tells you how well you have been managing your blood sugar over the past 3 months. It is the gold standard test for diabetes management, because it gives you an average blood sugar level over these 3 months. So this A1C test is not influenced by what you eat the night before or how much exercise you did the week before. It's not influenced by that. It's an average of the past 3 months. And so a person's living with diabetes, they need to know what their A1C is.
Yeah.
Because if they know what their A1C, then they can work to bring that level down to where it's supposed to be.
Yeah.
People who have normal, people who are not living with diabetes, their A1C has to be below 5.7%. People whose A1C is between 5.7 and 6.4% are at risk for diabetes.
Yeah.
Who have A1C 6.5% or higher, they have diabetes. So persons who are living with diabetes, their goal is to make sure that their A1C number is 7 or below 7.
Yeah.
This is a test that is done every 3 months. So imagine if people come every 3 months and they have their A1C test number, then they know what number they need to work on to bring that down. And people are walking around with A1C test scores of 10, 11, 12, and those are very high numbers. And those are in complications, which Dr. Hager mentioned, diabetes will affect your eyes, kidney failure, and even lower limbs amputation. What we're doing at the Diabetes Association, we have persons who have registered with our self-care management program. Like those persons who have registered, to know that we want them to take their A1C test. And like I said, a marker taken from your blood that tells blood sugar level for the past 3 months. So this is a perfect measurement. Like I said, it's a gold standard test for diabetes management. And anybody who is living with diabetes, we recommend that they take the A1C test and know what that A1C number is. And that will be their number that they will need to work on to keep it. If it's a tolerable range, 7% or below for persons who are living with diabetes, or if it's higher than that, they need to work to bring that down. Otherwise, complications will start to set in, such as blindness, like I said, kidney failure, and lower limbs amputation.
That's right, because it is the A1C actually monitors or is a better gauge to see what the fluctuation of your glucose level has been over time. So even if you eat good before you go to the doctor, it's still going to show whether you've been mismanaging your diabetes, and those fluctuations are what affect your organs. This is such a critical point, because I mean, we can talk about all the effects and whatnot, but people find it hard to adapt to the lifestyle that is necessary for a person who has diabetes or is pre-diabetic. Your self-management program is critical, because if they learn, if they have support, it helps. What are some of the things that you do to kind of get people aware of how critical it is to change their lifestyle and maintain that change as well?
Yes, the A1C is the marker, and that certainly, once they know what their A1C number is, then they will have to bring that down, and we work with them. We make sure that we provide syringes for them to do their tests. We provide strips and meters for them to do regularly, because persons living with diabetes need to have a monitor so that they can test regularly. And the A1C is there to be able to take that and see how well they're doing. And the goal is to bring that number down. It's just like somebody who is striving to reduce, has this excess body fat, and you want to bring that number down to a tolerable level. So that's the goal, and that's where the management comes in. It's a tool. So the A1 is like a tool. You have this, and really it does work with proper diet, exercise. It really, really works when people are so disciplined to bring down their A1C test scores.
So the theme for this year is nurses make the difference, right? Did I get it right? Nurses make the difference, right? Tell us about it and how you're going to include that in your commemoration.
It's a recognition of the work that nurses do on a whole, not only for persons living with diabetes, but as a healthcare worker, nurses contribute significantly to the delivery of the services that is provided in the healthcare system. And it's an acknowledgement of their essential contribution that contributes to the health of patients in general. And therefore, focusing on them this year is the acknowledgement that their work is keen, it's important, it's paramount.
I was.
Can I just butt in and say something here quickly?
Yes.
Sure.
Yeah, so talking about real experience, because it's good for us to know the treatment and everything, but we have to be realistic, and sometimes, the reality when you actually work in a hospital. I can tell you for a fact from working there for the last 12 years at the KHMH that I have seen the number of diabetic patients increase significantly. I don't know if it's the pandemic that is keeping people at home and maybe the carbohydrates, but I have been working in two wards recently, surgical ward and medical ward. And in surgical ward, one of the main complications that comes into the hospital is what we call diabetic foot. The diabetic foot is where you have ulcers or for some reason you hit your foot and it doesn't heal. That infection continues to grow and grow and grow, which can lead to amputation.
Amputation.
And or maybe amputation of one of the toes or two of the toes, and even what we call the AKA, above the amputation, or BKA, below the amputation. So that's one of the main complications that we see with diabetic patients in Belize. Another main complication that we see before they get to that point is what we call DKA. The DKA called diabetic ketoacidosis. This is for people who, because maybe they don't ingest sufficient water, or because they have a rich diet in glucose, even though they are diabetic, the sugar just goes so high that they can actually cause them to go into a coma. And so when they come to the hospital, it's because they are already in a coma. The ketoacidosis in their blood level is very high, and it's very hard to control at that point. No, sometimes they even might need to be intubated. They may need to stay in the hospital for a couple of days. So working there within the last years, I can definitely say that the complication that we see from diabetes is much more than before. Now, as you mentioned, Lynette, the kidney failure in Belize is a secondary effect of the diabetes and hypertension. And it's so much more now that sometimes we don't even have space for the people who need dialysis, because as you go into that kidney failure, you would eventually need hemodialysis. And there's so much people that needs it now that sometimes we don't have space in the hospital and in different institutions for the dialysis now. And the next thing to stress is that it's more important to eat healthy and stay healthy.
Yep.
Because like what Doc mentioned, prevention is better than cure. I see now that these people, because they haven't had the proper diet, haven't been living healthy, now they have to spend so much money on their health now, something that they could have avoided, right?
So while we're saying this, I'm here sitting down, and you did mention, Doc, that, stay healthy, eat healthy. There is this saying that I work out hard, I run 15 miles a week, but I eat anything that I want as well. I ride from here to Belmopan probably 2 or 3 times a week, and I eat any and everything, so I am not at risk for diabetes. Is that true or false?
That's not the case. When you look at it, it's a lifestyle, and a healthy lifestyle has 4 basic components: balanced nutrition, adequate consumption of water, and not just consuming 8 glasses, as some people like to say. We also have to ensure that we are involved in some physical activity. It doesn't necessarily mean going to a gym, but being physically active. You could be doing work at home. You could
go for a half an hour walk every day.
That's right.
Yeah.
And the last and certainly not the least, sleep, because the body repairs itself when we are asleep, and therefore it is important that it's a combination of all 4 aspects that contributes to a healthy lifestyle.
That's right. That's a critical point. I mean, I don't know. There are some people who exercise that much, but we know, or obesity and overweight indicators as well, which also makes it a more troubling situation. 2/3 of the country is either overweight or obese. So we do have a lot of risk factors. And what I hear from all of you is that this is still a very urgent situation, and we can't lose track of keeping the conversation going. You can prevent diabetes, developing diabetes, or delay it at least by changing your lifestyle. Any activities that people can participate in other than the healthy drink one that Dr. Gonzalez mentioned?
Yeah. Annie, we're celebrating tomorrow, right? Well, World Diabetes Day is tomorrow. So what are we going to do to celebrate this day?
Unfortunately, we cannot celebrate in the usual form that we would normally celebrate, John. But what we have some sessions that we will be airing and sharing out to the public. We also have some flyers that we will be distributing. We would have wanted to do free testing for the general public, which is part of our annual screening initiative for people to know whether they are at risk for diabetes or whether they have diabetes. So all these now have to be done, in limited, in cases where we're not exposing ourselves. As you know, people who are with diabetes are vulnerable. And so we have to take care of our people. And so the little we can do is perhaps just give out flyers. We have videos that we have recorded from previous sessions. Our sessions now are being held virtually every fourth Saturday of each month. We have guest presenters who make presentation to the team, to our members and the general public who are interested. And those are what we're going to be having next week as well.
All right.
All right.
Well, we are grateful.
The Lions Club.
Yes,
on
go
the
ahead.
Lions Club, though, we will be doing similar presentations to our Lions members. The Lions Club, we have 4 Lions Club in Belize, one in San Pedro, one in Bonaparte, one in Belize City, and one in San Roman. And so we'll be doing several to our Lions members as well through the same virtual medium. And then tomorrow we'll be giving out some pamphlets as well. Again, tomorrow what we'll be doing, we had some baskets again from some fruits basket, actually fruits and vegetable baskets from the public supermarket. We'll be giving those to the elderly homes tomorrow. So we as Lions members, we try to reach out to our public as well.
Yeah.
And we realize that a lot of the older people are already having diabetes. Sometimes they might not have the best diet. And so tomorrow what we'll do as a club, we will go and give out some fruit and vegetable basket at the elderly home in Belize City, All
right.
Fantastic.
Dr.
Well, thank you all for sharing with us the update as to what's happening. We really appreciate it. Best of luck. And of course, we'll check back in and find out how things are going. Maybe we'll try to get that recipe on air. We'll see. All right, we got to go ahead and take a break now. When we come back, we're going to be focusing on activities for Garifuna Settlement Day. So please